Feeling somewhat educational this morning, so while I attempt to do my makeup, this one doesn't want to be put down, so that might be a little challenge. But I wanted to talk about first trimester ultrasounds because I've gotten a lot of DMs and messages about what exactly happens during the first trimester ultrasound and what we're looking for. And there's actually 5 things that we look for during a first trimester ultrasound, so let's get into it. The most common one that I feel like everyone knows is to estimate your gestational age. So this is the dating ultrasound. In the first trimester, it's going to be the most accurate way to determine how far along you are and have an estimated due date. Now, we do use this hand in hand with your LMP or your last menstrual period. If you don't know what your last menstrual period was, then we go off of the first trimester ultrasound. If we do know your last menstrual period, then we do the ultrasound and compare. And if they're within 5 to 7 days, depending on how the baby is growing or how big the baby is, then we either go off of the LMP or the ultrasound. But essentially you use both. So it is important, and we like for patients to know their last menstrual period, just because it helps us have a more accurate dating. But that's going to be the first thing we look for in ultrasounds. Next up, we look for baby's heartbeat. So that's number 2. No, to answer everyone's question, the heart rate does not determine the gender. I don't care if 150 says it's a girl or whatever the myth is, it's a myth. So we just check for heart rate. It'll be significantly fast. In the first trimester, a baby's heart rate is super fast. I mean, in utero, a baby's heart rate is really fast. So even if it's like 160, 170, like that's totally fine. Okay, the third thing that we look for on ultrasound is the number of babies that we see. So the number of fetuses, obviously, if you have a twin pregnancy or higher multiple, then we want to know. I'm sure you want to know. So we look for this in the first trimester ultrasound, and it's easier in the first trimester to be able to tell what kind of twin pregnancy it is. For example, is it a di pregnancy, meaning each baby has their own placenta, own sac? Is it mono-di, where they each have their own sac but share a placenta? Or is it mono-mono, where they're all in the same sac and they only have one placenta? That's going to be the highest risk form of twins. So the earlier that you get ultrasound, the better we'll be able to determine the kind of twin pregnancy, and then that'll determine like management throughout the pregnancy too. The fourth thing we look at is going to be the presence of an ectopic pregnancy. So we want to make sure that the pregnancy is growing inside of the uterus, and that it's growing normally. Oh, cute boy. Because if it's in the tube or ovary or cervix or cesarean scar or something like that, that's an ectopic pregnancy, and we want to catch that early. And then the last thing we can do with first trimester ultrasound is look for genetic conditions. So in the first trimester, it's not like we can look at all of the limbs and anatomy well because the baby is like the size of a little tiny berry. But we can check for nuchal translucency, which is a measurement of like the baby's back of the neck, which can be really helpful. So we can do that. Usually we like to do it around 11 weeks. But obviously if there's anything that looks concerning, then we can do further testing. We can recommend to do the NIPT or whatever genetic screening test you want to do. So those are the 5 things that we do and look for in the first trimester ultrasound. If you're currently in your first trimester and you're waiting for that first ultrasound, I know how annoying that can be to just sit there and wait. We don't want to do the ultrasound when you're like 4 weeks because we're not going to see anything. And then it's just going to cause more anxiety typically for patients, because obviously when you're an ultrasound, like you want to see the heartbeat, and at 4 or 5 weeks, you're not going to see that. That is why oftentimes in the office, we don't do the ultrasound till later in pregnancy. See, every office is going to have a different standard of care. So talk to them and see when they can do your ultrasound. Hope that helped. Bye.